Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to your Wellbeing Matters Public Health Hour. I begin by affirming that there is none worthy of worship but Allah, and our beloved Prophet Muhammad, peace be upon him, is his messenger. And I pray that this program is beneficial to everyone listening today. Thank you, dear listeners, for joining us. It's astonishing to think that we are already entering the last third of Ramadan now. I hope your Ramadan has gone well so far, and I pray these last 10 days are the best 10 days of the month for you. I'm Nazira Vania, and I'm the Project Manager for Community Wellbeing Champions in Public Health at Leicester City Council. Over the course of Ramadan, we are aiming to bring you what we hope are relevant and engaging programs on health and wellbeing matters for our city. I hope you feel that this is going to be the case today, but before I introduce the topic of today's show, I'm going to encourage you to grab a pen and paper or have the notes app ready on your phone, as we will be sharing various bits of information about support and services that you might find useful to jot down, either for yourself or for someone else that you know. The audience is, of course, always the most important part of any show, so we also want to hear from you. You can send comments and questions via social media or the chat if you are viewing online, or you can send a message to the studio by text or WhatsApp on 0774 8855055. So that's 0774 8855055. So on today's show, we will be talking about children and young people's health and well-being. Let's get started with the programme by welcoming our guests, Clare Mills, Children's Commissioner from Public Health at Leicester City Council, and Alex Yeomanson, Family Service Manager for School Nursing and Areas 5 and 6 in Leicester City. And that's from the Leicester Partnership NHS Trust. And we are laughing because that is a mouthful of a title. But Alex will tell us more about that in a moment. So welcome, Clare and Alex. Thank you for being here.
Thanks for having us.
So Clare, beginning with you, please tell us a bit about yourself and the role that you play in public health.
Thank you so much for having me. So I'm Clare Mills and I work in public health at Leicester City Council. I'm Children's Commissioner, which means I'm responsible for ensuring there is good delivery around health visiting and school nursing in the city. And I work really closely with Alex and commission Leicester Partnership Trust to deliver that work. I also do some work around children who are in care. I looked after children and their public health needs, and support around breastfeeding and infant feeding and keeping babies safe, and thinking about all the things we can do to keep babies safe and well.
Okay, thank you, Clare. And Alex, same question to you then. Please tell us about yourself and that amazing job title of yours.
Mainly attention seeking, and apologies for my voice, I'm just getting over a cold. So I'm the Family Services Manager for the 0 to 19 Healthy Together service, and that's the service with health visiting and school nursing. So if you have a child under the age of 5, we give support to parents and babies, and if you have a child over the age of 5, we've got school nurses that support every school in Leicester City and can give you parenting advice, but also one-to-one support to your child or young person.
Brilliant. Thank you, Alex. Thank you. So we are talking about children and young people's health and well-being today, and it seems sensible to take it in that order and begin with children and those first few years in particular, especially how we can help babies to have a healthy and safe start in life. So, but before I go on to Clare with some questions, dear listeners, it is important to say that one of the things we are going to talk about today is how to keep babies safe and reduce the risk of babies dying suddenly and unexpectedly. So the death of a child is a devastating event for the child, their family, friends and community, and discussing this subject can be hard and bring back painful memories. But it is a really important subject to discuss, as there are simple things we can do to help keep babies safe. If this topic does affect you, the Lullaby Trust have a helpline that you can call and talk in confidence to trained volunteers. They can be contacted on 0207 802 3200. So I'll just say that again. It's a Lullaby Trust, and it's 0207 802 3200. So Clare, let's begin there if that's okay. What is infant mortality, and what number of babies actually do die?
So when we talk about infant mortality, we're talking about babies that pass away suddenly and unexpectedly in the first year of their life. And some of those babies there will be reasons why that's happened, and some of them we'll never really know why it happened. And that's what we call sudden infant death syndrome. And that's when there's never really a clear explanation as what's happened to that baby. But as we'll come on to later, there are lots of things that parents and grandparents and friends and family can do to really reduce that risk and keep babies really safe. And the numbers have reduced really significantly, particularly since in the last 25 years, since Back to Basics has come. Putting a baby on their back with their feet at the bottom of the cot is one of the most important things that families can do. And since that has been done much more frequently and universally, the number of babies that have died has reduced significantly. So in Leicester City, sadly, we see about 36 deaths last year out of a birth rate of about 4,600. So a really small number, but obviously incredibly significant for those families. And one of the things we want to do is make that number smaller, because we know it is higher in Leicester than it is in some other areas of the city, other areas of the country, and that England's rate is not as good as some other countries. So there is still lots we can do to help keep babies safer than we are at the moment.
Okay, thank you. So you sort of mentioned it, but where is the best place for baby to sleep?
So baby should sleep. Every sleep that baby has should be in a cot that is clear and flat, and should be in the same room as so at night time in the same bedroom, or for nap time during the day in the same room as family, so that they can be kept an eye on them. And one of the really important things to remember for me is we talk about the term, sometimes people use the term cot death, but that's not the correct term to use, because the cot is the safest place for a baby to sleep, as long as it's clear.
Yeah.
So we should really move away from using that term and use terms like sudden infant death syndrome or SIDS is a much better term to use.
Okay. And you said that's for night and for nap time.
Yeah, so for all night, all sleeps, nighttime and naps, because people sometimes get in the habit of thinking that's what I can do at night, but I'll do something different for a nap. But it should always be on their back with their feet at the bottom of their cot, in a clear bed, no bumpers, no toys. Those things look really cute and really lovely. Yeah. But we just put them on the side while baby's asleep in there.
Okay. And what if I'm out of my usual routine? So, you know, it's Easter holidays right now. It's Ramadan. People might be going to other places and they don't have the usual kind of setup. So if I'm out of my usual routine and I'm staying at friends or family's house, for example, what do I do then?
So one of the things that's really good to do is have a bit of a think about that before. So you've got a plan so that you know when you're going into this house where you might be able to put your cot or where your baby might be able to sleep. So rather than turning up and thinking, what am I going to do now, have a plan before you go about where you can put your baby that is a safe, flat, clear bed for them.
Okay, brilliant. Is it okay to sleep in the same bed as the baby? So obviously baby in your bed rather than you trying to get in the cot, but you know. Yep.
There's a lot of bed sharing.
Yes.
It's fine. It is, and fine to sleep with your baby in your bed, but again, you need to follow some really simple and really clear steps. So you should never, nobody, mum, dad, aunt, uncle, granny, should sleep in a bed with a baby if they are really, really tired, which when you have a new baby is a lot of the time, right? Because it's exhausting. If they've had any kind of drugs or any alcohol to drink at all, and that includes prescription drugs, so things that are likely to make you more drowsy than you would be anyway. And if you do bed share, you need to, again, make sure there's no covers, that the baby's safe and got space around them. And also, if you bring baby into bed in the middle of the night, which people sometimes do, to let your partner, if there's anybody else in the bed, know that that's what's happened. Yeah. So it is, bed sharing is fine, but you need to make sure everybody knows the baby's got the space, no alcohol and no drugs. Yeah. And not being excessively tired.
And that's including medication that can make you drowsy. Yeah. Okay. That's an important thing to sort of really think about.
Yeah. Because sometimes you think, well, we don't do drugs, but you might be on some medication that's making you really sleepy for some reason.
Yeah. What about sleeping on a sofa together?
So you should never, ever sleep on a sofa with a baby. That's one of the most risky things in terms of suffocation. So you see these beautiful pictures of babies on Instagram where they're kind of snuggled to sleep, particularly on dad, and dad's asleep too, and you think, oh, that looks so lovely and so nurturing, but really it's an incredibly unsafe practice. So if you feel tired, if you're holding baby and baby's asleep on you and you're awake, that's absolutely fine. But if you start to feel drowsy, baby needs to move somewhere, as we've said, clear, where they can sleep, or pass them on to another adult and you can have a little sleep. Never fall asleep with your baby. Okay. Because the risk of them suffocating is really, really much higher at that time,
Okay. Right. Thank you, Claire. So just sort of moving slightly onto kind of wider considerations for parents. When it comes to kind of feeding baby or affording things for the baby, if they're struggling to afford, food or other items for their baby, is there anyone that can help?
Yeah, so we know that breastfeeding is the best thing for a baby. It's best for baby, it's best for mum, and it's always, best for your wallet as well, because it's free. And that's particularly pertinent now and particularly important now, I think. So there's lots of support out there for people who want to breastfeed and continue to breastfeed and sustain that breastfeeding for as long as they want. But there are people who can't do that or choose to mix feed or to bottle feed instead. And what we are learning is that sometimes people will choose to feed their baby above themselves. So if you've got a really limited budget, formula is incredibly expensive, and you might choose to buy formula and not have something to eat yourself in order to ensure your baby's got enough food. But there are places that you can contact. So Leicester Mamas can offer support with vouchers in an emergency situation to get formula for babies. So can I give you the numbers for them? Would that be helpful?
Yeah, absolutely. I think that'd be really helpful.
Brilliant. So this is Leicester Mamas, and the phone number is 074 3595 3563 or 073 4145 2607, and they can help with vouchers, but they can also help with breastfeeding support. And they definitely they're a phenomenal organisation, and they will look at you and your baby, and they will make you feel not alone, and they will support you in your parenting journey.
That's really important, because parenting can feel very isolating, especially if you're struggling. It's hard to ask for help. You feel like you're the only one who's doing a bad job of it.
That's definitely.
And everyone feels like that. Everyone feels like that.
Definitely not the case.
Yeah, I'm just going to repeat those numbers. So 074 3595 3563 or 073 4145 2607, and that's for Leicester Mamas. Alex?
If you forget those numbers, don't worry about it. If you've got a contact with your health visitor will be able to help you connect yourself to Leicester Mamas as well. So do use your health visitors, and you will see your health visitors at regular points over your child's first 5 years. So ask them anything. If you're struggling, you don't have to struggle alone. They will be able to help.
Yeah, I think that's really important, as Alex said. So you can see your health visitor at key points, but you can contact your health visitor whenever you want to with any question. And they will always be there to help and provide the care and support that you need.
Okay. We've had a question come in. It's about nursing, but actually it might apply to this as well. So I have family members who would like to access the school nursing service, but English is not their first language. And that would apply to other services as well.
Absolutely.
So how do they speak to someone?
So all of the Healthy Together staff, we use translating apps. We also have links with translation services. All of our digital support can be translated into over 100 different languages. So if English is not your first language, for many of us it isn't, I would strongly recommend that you still make that phone call. Get somebody that you trust to say you're doing it on behalf of somebody else. But that phone call has to take place with the parent of the child, and we will need to know what language is best to have that phone call in, so that we can ask for a safe interpreter. We don't use family members because sometimes the translation could be mistaken or could be coercive. So we try and keep it as safe a contact as possible. But don't let your English not being a strong part of your language stop you from calling us as a service. If you need help, we're here.
Yeah, it's important to kind of remove as many barriers as possible to getting help. And
absolutely.
Okay, so Claire, back to you. So what do I do? Because you mentioned like parenting stressful and tiring and so on, especially when babies are crying. So what do I do when my baby won't stop crying?
I think one of the really important things to remember is babies do cry. That's how they communicate. And before you've had a child, sometimes you can't believe how much they do cry once the baby comes along. But it's completely natural, and it is completely normal. And there are peaks of times when they cry, it feels like incessantly, but over time that does reduce. But it's about when you're in that moment and baby is just crying and crying and you can't get them to stop, being able to think, are they hungry? Are they hot? Are they cold? Do they need changing? Are they poorly? And once you've gone through all those things, if baby's still crying and you need a break, it's back to this. It's fine to put your baby into their cot, their clear cot, on their back, and give yourself 5-minute break to calm down and kind of collect your thoughts and build your resilience and go back in and look after that baby again. It's fine to step out of the room, have a bit of time to just kind of manage everything that's going on. The one thing that you should absolutely never, ever do is pick up and shake your baby, because shaking your baby can lead to serious disability and in some cases death. So never, ever, however angry or frustrated you are, you should never pick up and shake your baby.
Yeah.
Give them to a family member, put them down, or if you're on your own, put them down somewhere safe, take some time and then go back and look after them.
It's okay if they're still crying.
Yeah.
They're safe.
Yeah,
you can take that break, and it'll be safer for them if you take that break as well.
Yeah, and again, back to what Alex has just said, this will be a reoccurring theme in everything we say, because our health visitors are phenomenal. But if you're really struggling with your baby crying, you can ring your health visitor. You can text your health visitor and get support around just how to your own mental health in terms of how to manage that baby, as well as tactics for helping baby.
Yeah. Okay. Thank you. Earlier you mentioned smoking. So what are the risks for babies around smoking, and how can someone be supported to stop smoking and to make their home smoke free? Yeah.
So we know that in a lot of cases where there has been sudden infant death syndrome, SIDS, smoking can be a risk factor in that. So it's really important that babies live in a smoke-free home. It's really important that when somebody is pregnant, they themselves are not smoking, and that people around them are not smoking. So in Leicester, everybody is offered, everybody who's pregnant the midwife will put them in touch with the stop smoking services to help them stop smoking. So I'd highly recommend people take up that offer there. And people can contact the Live Well team if they want to stop smoking and then they're not pregnant at any time. If you listen to this and think, I need to give that another go, I need to stop smoking. Live Well will offer that support to help people stop smoking.
And that is free support as well.
Yes,
from Live
that's
Well.
a really good point.
Had them on the earlier show, and that's free support. Take it.
And it's such an important thing, when you are pregnant and your baby is developing, that you're not smoking or not surrounded by smoking. Similarly, when you get home, to keep them in that smoke-free environment.
Brilliant. Just finally, Claire, then where can someone find support, information and guidance?
I think we've talked about it, but your health visitor should absolutely be your first port of call. So you can contact your health visitor, you can contact them through Chat Health, and you can contact them. We have websites, so Health for Under Fives. There's huge amounts of information on there for parents. Did you want to say a bit more about that, Alex?
Yeah, so the Parent Chat Health number is 0752 061 5381. I'll say that again because obviously I'm quite croaky. It's 0752 061 5381, and that we run that service. It's manned by qualified health visitors and support workers with absolute excellent knowledge on all sorts of topics, including safer sleep, giving up smoking, or just supporting you with your own mental health as well, because having a baby is really exciting, and all the media will portray it as being the most incredible thing, and you should bond with that baby straight away. But we know the reality of that doesn't always happen.
And there'll be all those beautiful pictures on social media that make it look
and
easy.
You've got
and so
to look like you're in control and you're having the best time of your life, and it doesn't always feel like that. Having a baby, particularly with all the things that have happened and the cost of living crisis, can be the most isolating experience, and it does play on your own emotional health and well-being. So use those numbers, use your health visitors, use all the support that we've got. If you're worried about making that text conversation, you could contact us through Health for Under Fives, which is, if you put that into Google, it'll come up and it'll give you lots of local knowledge about the services that are there across the whole of the city. Because the city is a vast landscape with lots of different cultures, which is why it's so amazing to live in Leicester. So there are lots of different stuff that we can support you with and access through those websites. They're safe, they're kept up to date, they are award-winning nationally. Had to say that. So I was, made sure that I got that in, otherwise the team would not be speaking to me ever again. But they are current as well, so they're local knowledge for local people.
Oh, we love crowing about awards in Leicester, don't we? Okay, so we're just going to pause it because obviously we've covered a really difficult topic. So just to give ourselves a breather and to take a chance to repeat that Lullaby Trust number. So if you have been affected by what we've spoken about so far today, you can talk to their trained volunteers on 0207 802 3200. Okay, 0207 802 3200. And if you've got any questions or comments for our guests in the studio, you can get in touch with us on social media, in the chat if you're listening online, or by text or WhatsApp on 0774 8855 055. 0774 8855 I'm going to ask the brothers to swivel the camera over to Alex now, because actually one more question for you, Claire, before we go over to Alex and sort of talk more about school nursing. But just to continue briefly with the early years, what the considerations are there for giving children a healthy start? I've heard the first 1001 days are crucial, so very briefly, what's that about?
They are. So the first 1001 critical days, which is basically your first 2 years of life, Alex checking that I say it right, are incredibly important, because that is about the foundation of your health and your knowledge and who you're going to be throughout your lifetime begins and really develops in that period of time. So it's really important that babies are getting the love and the nurture and the support that they need, and that, again, parents are getting the support to be able to do that. So really practical things like talking to your baby, visualizing with your baby, having eye contact with them, playing with them, giving them tummy time, letting them grow and explore and develop within the world is incredibly important, because they're little sponges at that time and their brains are forming. And becoming attached to you as parents and the wider family. It is really difficult. We've talked about places where you can get support right now. There is also support through things like the through the voucher scheme.
Early help.
Early help. So many earlies. Where you can get support as well if you need support to look after your baby. It's an incredibly important time, and that's why the health visitors are there to offer extra support if people need it. Yeah.
Okay, brilliant. Thank you, Claire. Right, brothers, camera on Alex, please. So before we know it, children are off to school, and that's where Alex comes in. So Alex, every school in the city has a school nursing team. These teams are public health nurses who offer clinical and other support to children in a school setting, but some people might not have heard of school nursing. So what does a school nurse actually do? What does a typical day look like?
There is no typical day in school nursing, I can tell you that for nothing. So a lot of people won't know who a school nurse is. You would only know who your school nurse is if you actually needed support and came into contact with us. That's probably the first thing to say. So if you do need support, if you ask your school directly, they will help you make a referral to us. School nursing is public health at its core, so we're about early intervention. The earlier we can help you, it stops it from getting bigger. And then you will hopefully either get the specialist support that you need quicker than you would do if you go down any other route, or we can give you strategies that might help you that mean you don't need to go on to other services for any other support. And by that I mean things like toileting, behaviour intervention, sleep advice, because sleep changes as you get older. Particularly with any of you that have got teenagers, or any teenagers that are listening, you'll know your sleep pattern is different to what it was when you were in primary school. So we can give you advice on that. Risk-taking behaviours, we can help keep you safe as well and give you advice on safety. There's an awful lot that you can get from your school nursing service. To give you a bit of a flavour of what we do, I would also recommend that you go on to our award-winning website, which are Health for Kids, which is for those in primary school, and there's a parent section on there as well. There's even a really cool game that looks at how you manage your toileting. I'd said that quite... It's not called managing your toilet at all, but it's quite a fun game. And there's also lots of interactions on how you can build your own emotional resilience as well, but also for parents, how you can support your child's development, and gives you strategies that you can do in a fun way with your child. When it comes to teenagers, there's an awful lot of stresses and an awful lot of difficulties that comes within being just a teenager in this sort of day and age. 24/7 lifestyle is really hard to keep up sometimes. So there's a lot of support on the Health for Teens website, as well as parenting support as well. So a school nurse doesn't have a typical day, but we do go into schools on a one-to-one basis when we've got parental consent to do so, to start the process of seeing what the problem is, because a parent might think that their child is having problems with behaviour, but when we go in and speak to your child, it might be that it's not behaviour, they're being bullied, but you don't know about it. And having that way of clinically assessing, it sounds really cold and it's not meant to be, but a clinical assessment that supports looking at emotional health, but also the triggers as well for physical presentation of what the child is experiencing is really important. So that's what a school nurse does.
Okay. So on that subject of emotional health support, so that can be a big issue for children and parents. What signs should parents be looking out for? And can you give some ideas on how we can support our children?
We're coming into exam season. So exam season is really stressful at the best of times. So you are going to see a change in how your young person presents themselves, because stress is a massive factor at the moment, but it can impact on their own emotional resilience as well. You might notice, particularly as families come together through Ramadan and Eid, that your child isn't engaging in the same way that they would have in the last sort of family get-together. They're not communicating in the same way. They would rather spend more time in their bedrooms. You think they're studying, but you need to know what they're looking at as well online. Online is quite a scary place, so make sure you've got those safety supports in place. If they're not eating in the same way, so their routines are out of kilter, or if they're staying up until 2-3 o'clock in the morning and then are really tired when you're going to wake them up. If they're wearing long-sleeved clothes that they wouldn't normally wear, we're in hot weather, they might be trying to hide something, so they might be pinching their skin or rubbing their skin or doing other things as well.
Self-harm or something like that,
increases at this time of year because of the stress of exams. So any changes in your young person or child's behaviour is an indicator that something isn't right, and it's not that you should constantly badger them, but it's having safe conversations. And if they don't want to talk to you, it's having the ability to say that's okay, but I think you need help from somebody. And in schools, there's lots of support. There are pastoral teams within every school that have got fantastic connections with the local community, and they could start those conversations and then see if they need any more support from somebody like ourselves, school nursing. Or there's also mental health support teams across the city as well, who have a different skill set to school nursing. So they're very much focused on cognitive behaviour therapies rather than looking at general strategies. So there's lots of support there, but any change in behaviour, it's really important that you have a conversation, don't push them, but then seek help and advice.
That's why it really helps to have other people there to talk to and do that sort of assessment, because these signs could have any number of explanations. It could be something quite straightforward. It could be something like safeguarding worries, exploitation, a whole load of things. So it helps to have sort of professionals to talk to and to do those assessments. What might stop people asking for help, though? I'm thinking back to my days as a children's social worker.
Social workers are scary people for a lot of people. You think as a parent that if you're not doing a good job, somebody's going to take your child away from you, and that isn't the case at all. We do everything across health, across social care, across all of the voluntary agencies, that we all work closely together to put in the help and support that you need. So it's that stigma that if you're not coping or you're not able to be the best parent on the glossy magazine, that you're going to have your child taken away from you, and that isn't the case. So all of our roles and jobs are here to help make sure that you're the best parent that you can possibly be. And that might not always be the best parent on the planet, but it's the best parent that you can be. So if you are worried about coming forward because you want some help and advice, because you're frightened of the consequences of doing that, text us. Texting means that you're not really connected, but you'll get the right support and the specialist advice that you need.
Yeah, so as a social worker, we'd be thinking in terms of, or the professional, risk factors and protective factors, and actually asking for help, recognising that I don't know if I'm, getting things right here, or I'm struggling here, or something like that. That's seen often as a protective factor because you're an aware parent who is seeking help and advice, so that sort of will be viewed positively if you do sort of put your hand up and say, I need a bit of help here.
We also go into every secondary schools and offer them the opportunity for young people to complete a health and wellbeing questionnaire, which looks at safety as well and risk-taking behaviours. And it's an opportunity for young people, yourselves, to come forward and say something isn't right and I need help. And it's a safe questionnaire that they fill in school, but the school don't have any oversight of it, and we can then provide one-to-one support or look at what support the family might need to help with whatever the young person is experiencing. So we have lots of different ways that we can assess safety and engage families within that as well.
Yeah.
We're just trying to expand that to make sure that every young person in Leicester City, in every school, has the opportunity to complete that health and wellbeing questionnaire.
Okay.
So, yeah.
Brilliant. I guess the next thing is we talked about emotional health and support. Moving on to physical health. So how can we support children to be fit and healthy?
Coming out of the back of COVID, this is a really important one. We've seen our obesity rates rise within the children of Leicester City, and we have got quite high obesity rates nationally in comparison to other areas. So getting out as a family and moving, going for walks, just doing things together as a family is really, really important. School activities do lots of physical exercise, but it's about getting involved in cooking, making sure that you know what you're cooking. Any celebration, no matter what religion or cultural background, means that you treat yourself. We're coming out of the back of our Easter celebrations, and I can guarantee that we've eaten our body weight in chocolate across Leicester and the Christian population. However, all of those celebratory foods got quite a high fat content, and although you do them to celebrate and come together as families, it's being mindful that you need to increase the exercise. Getting young people involved in the kitchen is a brilliant way of making sure that they can make the healthy options, because as a family you can do that together. But it's all about doing things as a family and increasing physical activity. Yeah.
And actually in a previous show I mentioned sort of as a young person, as a child, getting diet sheets because I had a weight problem that were like completely unrelated to sort of what I ate at home. So is there sort of culturally appropriate guidance? And
absolutely. We have something called an Eat Well plate that we use, and children shouldn't be put on diets. I think that's the first thing that we need to say. It's about making healthy lifestyle choices, not being on a diet. A diet has all sorts of awful connotations that will follow them for the rest of their life and can increase eating disorders as they get older. So it's about making healthy lifestyle choices. And no matter what cultural background you're from, we have Eat Well plates that can show you portion sizes within different cultures and the food stuff that you would have as part of your celebration or part of your day-to-day dietary intake. So there is always culturally sort of appropriate resources that we would use.
Okay. Just going to pause there. There was a message, a little shout out to Claire from someone who used to work with you, Claire. Really so happy to see you or hear you on the radio. So, okay. So thank you for that, Alex, on physical health and well-being. Sleep is really important when it comes to that sort of thing. And you mentioned sort of the sleep need of younger children, the way it changes as teenagers. It seems to go like they sleep a lot as babies and then they sleep a lot as teenagers. And so tell us about kind of sleep routines. And obviously with Ramadan, that kind of will have changed that temporarily for, a lot of Muslim children. But the importance of sleep routines generally, and then sort of how we might be able to support that.
There's always times in anybody's annual calendar where you have celebrations that will disrupt sleep, but where possible, make sure that the routine is always the same. So a fantastic routine to bring families together is a nighttime routine that involves talking and sharing what's happened during the day. That will take you really nicely into when you become a teenager, because it becomes normal to have a conversation about school and things that you experience. But an example would be a nice warm bath that you can have an interactive play, a nice bedtime story, or just sitting and talking about how your day was. Making sure that the bedroom is warm and safe where possible. So if the child is frightened of the night because it's dark and it is a scary place sometimes, make sure there's a little night light. There's nothing wrong with a night light. The worst thing we can do, though, is to provide them with a mobile phone or a tablet to go to sleep with, where they can watch on a screen a cartoon or a movie. That stops you talking. But it also stops the brain from releasing the sleep hormone that it needs to help children go to sleep. So avoiding mobile phones at all times for at least 2 hours before you go to bed is really important. And having the ability to read a book, and even if you can't read yourself for whatever reason, maybe you weren't taught how to read or English isn't your first language, talking through and making pictures and stories out of the pictures is absolutely fantastic, because it helps to really increase imagination and your ability to have those conversations. And then when it goes into the older generation, the brain tricks you into thinking that it's not tired, and that's to do with your computer and screen time.
Okay.
And it's really hard not to have a Facebook conversation. In fact, that probably puts me in the older age group, and it's now Instagram or TikTok. But those things, you feel like you're missing out. But actually, by looking at those screens all through the night, your brain isn't able to switch off or close down, and therefore you're always tired. With exam season coming in, you'd be tempted maybe to do some more revision late into night, and that's not going to do you any good at all, because you're not going to remember what you were trying to revise by the time it comes to the morning. So removing screen time at least 2 hours before bedtime is really, really important. And then having a safe space to sleep is also really important.
Okay, so could you say a little bit more about that? Because we've talked about safe spaces for babies. What does that mean for old children or young people,
Babies
teenagers?
and children listen. So a safe space is a space where they can close their brain off and not have to worry about any adult conversations, or if there's anything going on in the family home that could be quite scary.
Yeah.
And as a parent, life isn't always perfect. And as a couple, if you're in a partnership, sometimes you don't always agree about things. By arguing or raising your voices, and that gets louder and louder and louder, a child will hear, and that can be quite scary for them. So a safe space is try and keep your voices as low as possible. You're not always going to agree as a couple, but actually for a child to hear you arguing, you might not think they can hear you, but they can, has a massive impact on how well they sleep or feel safe. So the temptation for a child, particularly as they get older, is to come downstairs and make sure whichever parent is having the raised voice directed at them is safe.
Right.
So that's what I mean by safe spaces. And also with particularly the under fives, if you've got plugs near the cot or the bed, make sure you've got a plug cover on, and you can get anything like that from, if you speak to your health visitor, they will help advise you. Okay. There's an organisation called Baby Basics that will be able to support you with all sorts of things to help keep your baby safe, and also any child into teenager as they move forward.
Okay. That's another useful organisation. So many useful organisations being mentioned. If you want to make scribble that down. But okay, so if we just sort of touch on that actually a little bit more, Baby Basics. Tell us about them and how you can kind of access them and get from what you can get.
You can't access them directly.
Okay.
Yourselves, you need to go through your health visitor, and you can speak to them about what it is that you're needing. So that could be a cot, it could be chest of drawers, it could be absolutely anything.
They do clothes, they do nappies, they do deodorant.
Okay.
So anything that you might need for your baby that you're really struggling to get hold of.
Yeah.
If you talk to your health visitor, they can do that referral to Baby Basics for you. But similarly, when your child grows up, if you want to donate your cots or your buggies or your high chairs or all those baby clothes that they seem to grow out of every single week.
They grow out faster than they're worn out, so they're still pristine condition, aren't they? And
then Baby Basics are always looking to take those donations and pass them on to families that need them. So that's another really good way of passing things on, sharing.
Are there sort of limitations as to what you can pass on?
I think the best thing to do is get in touch with, so for passing on, you can get in touch with Baby Basics directly, and they will tell you what they're after. They quite often have a wish list on Facebook, and sometimes they have an Amazon wish list, but really they won't, if they've got the space, there's very little they'll turn away, because in this city, sadly, there's a huge amount of need for cots and buggies and clothing and nappies and things we've talked about.
When it comes to cots, is there...
The one thing they won't be able to provide you with is the mattress. Yeah. So when you either re-gift or receive a cot or a bed, you won't have a mattress. And I learned this week actually from my health visiting colleagues, because I always thought it was due to infection, but actually it's to do with the breathability of the mattress. So where a baby has been lying on a mattress over the space of the year to 2 years that they've been in the cot, it's normally 2 years, but over that space of time, compresses down and the breathability is affected, and then that can increase the risk of the baby not being able to breathe properly should they move onto their side in the later part of their babyish years.
Yes, that's a really important point, just to kind of go back over that. Baby Basics will give you you know, if you give something to Baby Basics, they will gift out a Moses basket with a new mattress.
Right.
If you are passing a Moses basket or a cot on to a family member or to a friend, make sure that either you or they get a new mattress.
Right.
So the frame, as long as it's intact, is brilliant still to use.
Yeah.
I mean, oh my God, goodness me, the ones I had were years and years old.
Yeah.
But the mattress needs to be new for each new child.
Okay.
That's really important to do.
Yeah. Brilliant. Okay, so school nursing, back to school nursing. I think you mentioned award-winning websites and things already, but the school nursing have a digital offer, and how do people get in touch with their school nurse?
A digital offer means that we've got lots of different ways that you can contact us. So when we say our digital resources, that's our websites where there's some fantastic information on there, but it also gives you all the information you need on how to make contact with us. So we have got texting services for both young people and parents alike. For young people, the information is on the Health for Teens website, but I will give you the number. So if you're a young person listening to this and you think you've got a question about either your emotional health, your physical health, or any other element of your sort of experiences, please do ask a question. You'll have a safe response from a qualified school nurse. And the number for that is 0752 061 5386. That's 0752 061 5386. We do operate all the texting services Monday to Friday, unfortunately, between the hours of 9 and 5. You will get a bounce back message if you text any time after that, and the person coming in the next day will pick up your message should it be outside of those hours.
Okay.
And we don't operate on bank holidays either or weekends.
Okay.
But on the website, that's available 24/7. So there's all sorts of fantastic information. So if you're worried about a friend that's self-harming, because you mentioned self-harming earlier, there's information on how you as a friend can support your friend with different strategies to stop them hurting themselves. But just by talking to them and having that conversation can help.
Okay.
Our award-winning digital offer consists on all of those.
And I mean, that sort of the cost of living crisis and everything, and mental health is a huge issue for adults, but we know it's a huge and growing issue for children and young people as well. So
and I think
just to restate that,
Sorry, just to point out, if somebody, you will get fantastic support from the chat health lines very swiftly, but it's not an emergency service. So if you are in crisis, you should be contacting people like the Samaritans who can give you help immediately there and then to support you. If it's something that is really urgent and really important but can wait a bit, the school nurse is a great person to contact.
Also, obviously, GP, hospital,
absolutely,
and so on and so forth as well. Okay.
And I think just to come back to your earlier point, you know, if you feel you want to ask for help, you should ask for help because there's a huge amount of people out there to support you. Yeah. You're absolutely not alone. You're not the only person asking for help. You're not the only person feeling that way. So do reach out to all these brilliant resources and people that we've talked about today.
Okay. And just finally, we've touched a lot on sort of the expense and the struggle to afford that. So, but anything else around cost of living and help that's available through schools for children and young people?
So women don't get a choice. We have a monthly period, so we menstruate every month. And that starts when you're a teenager and carries on until you go into your 50s or 60s or whenever that might be. Yeah. Depending on your hormone levels. But if your family is really struggling to put food on the table, it'll be very hard for them to possibly buy your sanitary products as well. Please don't be embarrassed. We don't get a choice. It's not something that we get for free. I don't understand why we don't, but that's a whole nother topic, not for the radio. But the majority of schools in Leicester City have got support for young women who are experiencing a monthly menstrual cycle but can't afford sanitary products, because unfortunately in this day and age it's still a case that if you can't access sanitary towels or tampons, depending on what you feel the best at using, it stops you from going to school, and therefore it stops you from engaging in education and making a difference in your life. But that shouldn't be the case. You should be able to access support for that for free. So do talk to your school about that, because a lot of schools in Leicester City do have free sanitary products.
Okay, thank you, Alex. Yeah, and just to touch on that, that's for school children, but there's also help from the children's centres for adults looking for the same support. So we are, that's flown by. We're in the last sort of 40 seconds now. So I do need to wrap up. Thank you, Alex. Thank you, Claire. Thank you, listeners, for joining us again today. And thank you to the team at Ramadan FM for giving us this opportunity to speak with you about all things public health. We did cover a lot there, and there were loads of numbers and loads of organisations. So if you've missed anything, email us at wellbeingchampions@leicester.gov.uk. Wellbeing Champions, all is one word, leicester.gov.uk. And we'll just sort of send that over to you. We'll be back same time next week, 11 o'clock on Tuesday, talking about key health conditions. Until next week,